in relation to the 27-year-old, I was very keen to hear from the doctor after comments by Alan Jones last night.
A man in his 20s has died, and Berejiklian and the de facto Premier, Dr. Chant, come to the press conference, and all we get is evasiveness. This man died in his home in southwest Sydney. Will there be an autopsy? Well, the coronavirus guidelines, I'm advised, don't say that an autopsy is required. They do allow the recording of a death as a COVID death without an autopsy. If the man was seriously ill, why wasn't he hospitalised?
Well, that's ill-informed utterances. I mentioned before, Alan is very well researched and half the stuff he talks about is bullshit, and that's bullshit. It was revealed yesterday, shortly after his death, there would be a coroner's inquest into his death. You've just heard from the doctor, Dr. Tataro. I'm sorry, but I'm quite emotional about this because it's irresponsible for that stuff to be broadcast, and Sky News should be absolutely ashamed of itself, as should the man that controls Sky News, Paul Whittaker, for allowing that to go to air. I believe people sit in the control room with a button to press in case things are said that could be offending the great number of people who may be watching it at the time. That button wasn't pressed on that rubbish last night. As you heard from the doctor, Tataro, people were dropping dead in all parts of the world via this Delta variant. Now, obviously, there will be a coroner's inquest into the death of this young man. It's inarguable that he had the virus. It's inarguable that he was getting care for 13 of the 14 days he was in home quarantine. Why wasn't he in hospital? Because he wasn't sick enough. But all of a sudden, he got dreadfully, dreadfully ill, and evidence from across the world will illustrate that's what can happen in a minority of cases. That's what can happen. And to suggest that Dr. Chant and Gladys Berejiklian, as critical as I've been of both of them at varying stages through this, would be in a conspiracy to try and dupe the public into believing the bloke actually had a heart attack is just absolutely reprehensible. Someone at News Corp made a decision regarding this bloke's column in the Daily Telegraph. Someone needs to make a call on these irresponsible, stupid comments he makes on a regular basis. I've had a gutful of him. I worked with him for 35 years. As I said, half of what he does is well researched. The half is absolute and utter bullshit.